Ladies and gentlemen, you are welcome. I'm Dr. Prosper Tettey Doe. I'm a psychiatrist practicing in the United Kingdom. And this presentation will be on psychiatric presentation of endocrine disorders. So welcome to this brief presentation, which will highlight some of the important areas that are necessary in the practice of psychiatry to take notes when a patient has endocrine disorders to be able to diagnose. These endocrine disorders will be covered: Cushing's syndrome, acromegaly, hyperprolactinemia, growth hormone deficiency, gonadotrophin deficiency, hypothalamic syndrome, hyperthyroidism, hypothyroidism, hypercalcemia, hypocalcemia, Addison's disease, pheochromocytoma, insulinoma, and polycystic ovary syndrome. The Cushing's syndrome may present with symptoms of depression, psychosis, insomnia, and anxiety. Acromegaly, patients may present with affective disorders like depression and dysthymia. In hyperprolactinemia, patients may present with irritability and depression. In growth hormone deficiency, patients may present with depression, anxiety, impaired self-esteem. In gonadotrophin deficiency, presents with symptoms of depression, anxiety, irritability, insomnia, and poor memory. Hypothalamic syndrome presents with behavioral change, somnolence, eating disorder. Hyperthyroidism presents with emotional lability, anxiety, restlessness, rarely psychosis. Hypothyroidism may present with depression, paranoia, cognitive impairment, slowing of intellectual function. Hypercalcemia presents with depression, tiredness, confusion, coma, if extreme. Hypocalcemia presents with seizures. Addison's disease presents with mild disturbance in mood, motivation, and behavior. Also psychosis and delirium more rarely. Pheochromocytoma presents with panic attacks, anxiety. Insulinoma presents with irritability, confusion, aggression, coma, and anxiety. And finally, polycystic ovary syndrome presents with affective disorder. So these are important in assessing patients with endocrine disorders who may have a psychiatric presentation. And so looking at Cushing's syndrome may present with the buffalo hump, supraclavicular fat pads, thin or easily bruised skin, hypertension, diabetes mellitus, striae, low libido and impotence, menstrual irregularity, thin skin on dorsum of hands, osteopenia or osteoporosis, proximal myopathy, that's the size of the legs disproportionate to weight. Psychiatric symptoms include psychosis, depression, and mania. Clinical features of acromegaly are frontal bossing, prominent supraorbital ridges, macroglossia, that's a large tongue, increased interdental space, goiter, bitemporal hemianopia in pituitary tumor, increased prevalence of affective disorder, depression or dysthymia, increased sebum secretion, prognathism, that's protruding of the jaw, enlarged heart, coarse and oily skin, increased sweating, enlarged liver, increased glove size, increased shoe size, and associated features include diabetes mellitus and insulin resistance, also colonic polyps and carcinoma, and sleep apnea, and finally, enlargement of all organs except the testes are the clinical features of acromegaly. Now, signs and symptoms of hyperthyroidism and hypothyroidism. Compare. In hyperthyroidism, there is hair loss. In hypothyroidism, there is hair loss. In hyperthyroidism, there is exophthalmos. Hypothyroidism, periorbital edema. There is macroglossia in hypothyroidism. Goiter in hyperthyroidism. Sinus tachycardia in hyperthyroidism, whilst in hypothyroidism, there is bradycardia and cardiomegaly. Whereas in hyperthyroidism, there's atrial fibrillation. Heat tolerance in hyperthyroidism, and dry skin in hypothyroidism. There is weight loss and increased appetite in hyperthyroidism. There is weight gain in hypothyroidism. Hyperthyroidism presents with diarrhea, and hypothyroidism presents with constipation and megacolon. In hyperthyroidism, there is fine tremor. In hyperthyroidism, there is acropathy of fingers and toes. In hyperthyroidism, there is impotence or amenorrhea. In hypothyroidism, there is menstrual irregularity. Hyperthyroidism presents with pretibial myxedema. In hypothyroidism, there's prolonged relaxation phase in reflexes. The symptoms of hyperthyroidism also include sexual dysfunction, diarrhea, emotional lability, anxiety, restlessness, psychosis, insomnia, and fatigue. In hypothyroidism, symptoms include depression, paranoia, cognitive impairment, impaired motor function, fatigue, and tiredness. And these are all important. Thank you for your attention.